When I look outside IHI, a number of our Leadership Alliance members have made important steps as they've followed that path that we set out in the Pursuing Equity white paper. And so one very practical but hugely important thing that a couple of partners have now done is to guarantee all other staff a living wage. And of course, the absence of a living wage impacts much more heavily on people of colour than it does on white people. And so in guaranteeing that to every member of staff, they've made an important contribution to securing health equity. I think the other thing that I'm beginning to see is people starting to understand that and change their perspective from one where they start with saying health equity is too much of an investment for us, to understanding that absence of health equity is too much of a cost for them, because there are studies that show that the extent of the inequities in the US health system cost in excess of $300 million a year. I mean, and again, I make no excuse for trying to entice people into this conversation with an economic argument. If that's what it takes to get people to come to the table and start to address this, so be it. So overwhelming, I think, is the need for a light to be shone on these issues that I think we should welcome people regardless of their motivation, because once we have them in the conversation, we can begin to develop the understanding, build the coalition, create the forward momentum, start to draw people in as advocates and partners and change agents.